Glucosamine Sulfate in the Treatment of Osteoarthritis by Greg Vick. What is glucosamine sulfate? Glucosamine sulfate is a naturally occurring compound. That means it occurs naturally in the human body, and it is a component of healthy cartilage. It is one of the building blocks of the cartilage matrix, which make up all joints and synovial fluid. And synovial fluid is the fluid that surrounds and protects most joints in the human body, especially the movable joints. Glucosamine sulfate is the main ingredient of many joint improvement supplements, and most often comes from the shells of shellfish, which means that it could possibly be allergic to some people who are allergic to shellfish, so that is something they need to watch out for. What is osteoarthritis? Osteoarthritis is the most common joint problem in older adults and can be caused by wear and tear from aging as well as from friction. Normal cartilage is firm and rubbery. It is a firm and rubbery substance that cushions the bones at the joints and allows the ends of the bones to slide past one another. And when this cartilage wears down over time, it can allow the bones to rub together. They call this bone on bone, and that's when you really get a lot of wear and tear, a lot of damage. Most people have some symptoms of osteoarthritis by age 70, although it can appear as early as middle age, and there are certain other factors that can exacerbate it, such as weight issues and things like that. Genetics play a role in osteoarthritis, as it can run in families. If your mother or father have osteoarthritis, it can present at an earlier age for you. Excess weight can increase the risk due to increased wear and tear in hips, knees, ankles, and feet. And there are several contributing factors. Would be fractures or joint injuries at a younger age, jobs that involve kneeling or squatting. I guess some of the people who have the worst would be people who lay carpet for a living. Impact sports such as football, twisting sports like basketball, or anything with repetitive motions. And you know, if you sit at a keyboard all day typing, you can actually get osteoarthritis in your fingers and wrists and all those bones. Most common symptoms of osteoarthritis are pain and stiffness, which worsen after exercise, and they worsen with weight and pressure. And over time, joints can become more stiff and difficult to move, eventually producing rubbing or crackling noises during movement. That's how you know when you've got it really bad, is whenever your joints actually make noise. And how is glucosamine sulfate used? It's taken orally, either in 500 milligram tablets taken 3 times a day, or 1500 milligram tablets taken once a day. It can also be mixed into skin preparations, analgesic skin creams, although there is no evidence that it is absorbed this way. It definitely absorbs through the intestines though. Over the past 40 years, there have been over 100 studies testing the effectiveness of glucosamine in treating osteoarthritis. Most of these test for pain relief and improvement in range of movement, and the majority showed improvement in these areas. I've used 3 of these studies for illustration purposes. A study in 1980 by Drovanti, Bignamini, and Rovati gave 80 patients 1,500 milligrams of oral glucosamine sulfate daily versus a placebo. The glucosamine patients had a larger reduction in overall symptoms, as in 73% versus 41%, and this improvement happened in half the number of days, as in 20 versus 36. A study in 1982 carried out by Lopes gave 40 patients either 1,500 milligrams glucosamine sulfate versus 1,200 milligrams of ibuprofen daily, and this was a blind study over an 8-week period. The ibuprofen patients showed more improvement in pain reduction during the first 2 weeks, but by the 8th week, the glucosamine patient showed a significant improvement over the ibuprofen patients in pain reduction. And in 1980, Pujalti, Lavore, and Les Cupides did a double-blind study using glucosamine versus a placebo. And let's see, using a 500 milligram dosage over an 8-week period, the glucosamine patients experienced an earlier and more pronounced reduction in symptoms than did the placebo group. In each of these studies, there was no adverse reactions or no drug-related symptoms, meaning negative drug-related symptoms noted. Okay, glucosamine is a possible treatment for osteoarthritis. So to conclude, it is a possible treatment. Most studies use a range of 500 to 1500 milligrams of glucosamine sulfate for 30 to 90 days. Approximately 70% of orally administered glucosamine is absorbed in the intestines and the intestinal lining, and most patients experience relief by 6 to 8 weeks, and individual results may vary. Thank you, and I am done.